Hello, my name is Linda Shevlin and I am an infection control nurse based here at RCH Treliske. Two things. One, did you know I'm a fan of history? And two, did you know that it's World Hand Hygiene Day on the 5th of May? Have you ever stopped to think who thought it was a good idea to start hand washing? Well, you may be surprised to know that hand washing has actually appeared in documentation from many centuries ago, mainly in cultural practices and religion. But it was relatively recently when the link between hand hygiene and wellness and infection was made. I'll give you an example. Let me introduce you to a gentleman called Jakub Koleżka. You may not know that name, and there's no reason why you should. He's actually famous, unfortunately, for dying. Allow me to explain. This gentleman here, Mr. Koleżka, was a professor of surgery at a general hospital in Vienna. He was responsible for teaching medical students anatomy, and obviously one of the best ways to do that was to perform autopsies. On one particular occasion, a student who was assisting him in the autopsy nicked the doctor's finger with a knife. Now, today that would trigger a whole process about needle stick injuries and care for our staff. All sorts of tests would take place. Obviously in those days, no such systems existed. So he cursorily washed his hands, went home. Then the next day, he developed symptoms such as fever, cramps, unexplained rashes, and was rushed back into hospital as a patient. Now, Mr. Semmelweis, or I should say Dr. Semmelweis, comes in at this point because he was the best friend of Mr. Koleżka. When he heard his friend was very ill, he was distraught and spent many hours sitting at his friend's bedside. But obviously he was a physician, and he noticed that the symptoms his friend was suffering from mirrored the symptoms of women in his maternity unit, who after a few hours of giving birth were developing very similar symptoms. Unfortunately, as I said earlier, his friend died. And Dr. Semmelweis was haunted by this image of his poor friend in such an awful way to die. He was also haunted by the image of all the women who were dying, and he was desperately trying to work out the link between autopsies and his patients dying of some unknown cause. So he decided to plot the patient's journey. He followed the doctors to their practices where they did their autopsies in their street clothes, very cursory hand hygiene, as in water, and then suddenly they may get called away from an autopsy to go and deliver a baby. Now some doctors will rush out and just dry their hands quickly on a bit of towel, or some doctors may stop and wash their hands with water. But Dr. Semmelweis noticed that their hands actually smelt very unpleasant, and afraid it was bodily fluids. He suddenly started to make the link that the bodily fluids on the doctor's hands were infecting his patients, who then 6 or 8 hours later were developing signs of sepsis. Many women over the centuries have died of sepsis, usually known as childbed fever in the past. One famous victim of childbed fever was the third wife of King Henry VIII. She gave birth after 36 hours, and within 12 hours she had died. Dirty conditions, people not washing their hands. And it's still a modern phenomenon in some countries where asepsis is not watched. Now, Dr. Semmelweis, being the kind of person he was very insistent with his colleagues that they should wash their hands properly and talk about asepsis, although that's not how he talked about it in those days. Unfortunately, Dr. Semmelweis was known for his, how shall we say, direct approach, and his colleagues were most unhappy with the way that he brought in this new change without their collaboration. He didn't consult them, and they felt insulted at the idea that they were responsible for people dying. So it took actually many years for Dr. Semmelweis to make any real impact. However, when he eventually did, with new doctors coming in who were more willing to listen, the mortality rate went from 18% to 1% and remained low. That is a massive achievement. And don't forget, Dr. Semmelweis almost must be credited with asepsis like we use in surgery now. ANTT all links back to him. We are extraordinarily lucky to live in the times that we do, where we've got the evidence and the knowledge and the education, where we can give our patients the most safe, basic care that we can offer. Now, as an example of that, we have the 5 moments. The World Health Organization developed this in 2009. So again, that was quite recently. There's an aid memoir, when we should wash our hands. So historically, Dr. Semmelweis developed the link, but it still took many, many decades for it to become integrated into our daily nursing and medical practice. So as link practitioners, you're ideally placed to educate staff on the wards and monitor practice, because what you need to remember is every missed opportunity is a patient at risk. Every patient who comes into a hospital deserves to have staff with clean hands. That's a given. It should always be a given, but never get complacent. Now, Dr. Semmelweis had a rather ignominious end to his life. He developed what they think was some sort of psychosis, and he was admitted to an asylum by his colleagues, where he died of blood poisoning, thought to be developed from being beaten by his carers. A very sad end to a man who changed practice forever, and who actually became known as the saviour of mothers, or the father of hand hygiene. So he died sadly on his own. Let's not waste the sacrifices that he made, and think about all the patients that have died through the ages simply through bad hand hygiene. It's World Hand Hygiene on the 5th of May. That is not just a day to be washing your hands more than usual, it's a day to reinforce that important message. Every missed opportunity is a patient's life put at risk. Thank you for listening.